So what you'll do if you are interested is you'll reach out on our website or give us a call. We have intake clinicians that are going to meet with kiddo and the family before they're admitted to our programs. The purpose of that assessment is for us to make sure that we are the right fit for you. And if we're not, we're going to make sure that we connect you with the resource that is. It doesn't matter if it's us or somebody else. We want to see you grow and succeed.
We schedule the level of care during which a clinician really asks all the questions we need to know. And then they talk to the individual client, the kiddo, adolescent, and they talk to the parent. A lot of times we get the two sides of the same coin, sometimes we don't. And then sometimes the answers are actually in those gaps. And that clinician would decide what level of care. Do they need just more intensive services than regular outpatient once-a-week services, or is it a several times a week? If it's a several times a week, is it 3 times a week or is it 5 times a week? And how many hours a day?
If you're accepted into our program, you'll usually know that day or the next day. We work really, really quickly because we know when you are seeking mental health services, when you make that Google search, you often can't wait 3 or 4 weeks. You need something right now.
If someone has high needs, we don't want them sitting around and waiting. We want them in as soon as we can. So we push the whole system, which is the insurance, transportation, the availability in groups to make it happen.
We equip you with all of the information. You'll receive a tour. You'll get a brief orientation so you know what to expect. We'll run through the schedule with you. Again, that way when you walk in on day 1, you already have an idea of, okay, here's how this day that I know is gonna be really hard, but I know what to expect, so here's how it's gonna go.
And then the kiddo starts. That's when they're assigned an individual provider. And that individual provider is the contact person for the family, for the medical provider, for school, for court, and for the kiddo themselves. And they basically track progress and see that the individual actually benefits from our services, because again, we want them to benefit from the point that they start. And once we see that they're ready to step down, so less intense services, sometimes it's again with us, and sometimes it's with an outside provider. So we try and bridge those gaps so that things are as seamless as possible.
We are constantly focusing on accessibility.
Some families can't bring in the kid during the morning. Some families can't bring in the kid in the afternoon. Sometimes there's afternoon activities or court involvement, and so we work with them to create a plan that works for this specific family.
We work very closely with a lot of the school systems in the Denver and Westminster areas. And we also work with a lot of other community resources, but it's as simple as searching our website if you're just a family with a kiddo in need.